This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Looks like we are all set. So, all right. Thank you all for coming out tonight. We're looking forward to another great event. So really appreciate you showing up and showing interest in childhood neurodevelopmental disorders and what we can do here with functional neurology. So a little bit about me before we get too deep into the presentation. My name is Joseph Coppus. I am the owner here at Delta Neuro Health. I'm also a husband, an expectant father, former patient. I'm a functional neurology and functional medicine practitioner. I am the host of the current Neuro Health broadcast and the previous the Neuro Wellness podcast, and a brain health advocate. A little bit about our clinic then. Delta Neuro Health. We specialize in what's known as functional neurology, functional medicine, neurofeedback. We also have chiropractic care here, as well as clinical nutrition. So the lead clinicians here are myself and then Dr. Jill Wagner, who oversees mostly the functional medicine and the clinical nutrition components of our practice. So a lot of people ask me, why is our name Delta Neuro Health? Right. So Delta means change in physics, right? But it also could mean kind of the split in a river that's then leading into this vast ocean, right? So that kind of struck me because especially when I'm working with children, I see kids come in with a lifetime of potential ahead of them. And I try to picture myself as a fork in the road or a fork in the river for that child, in that if they don't come to me, chances are they're going to go down one side of the river, down the side of medication, which is going to lead to more medication, which is going to lead to more symptoms, and so on and so forth. Starting at a very young age, the cycle doesn't tend to stop. So that's one option. But then I picture myself as a fork in the road, like I mentioned, where if I can make a substantial change in that child's life, I just imagine how many years of life potential of, reduced medication, of reduced symptoms through natural means. If I can provide that for that child, their life is going to be tremendously different. If you change the trajectory of a rocket just a few degrees, and then you expand that over miles, that rocket, by the time it, say lands or ends at its destination, it's going to be so far away just by changing its initial trajectory a couple degrees. I'm not a trigonometry expert, but that's that's my math skills right there for you. But you get the idea. So we're really here trying to create that change or create a fork in the road for that child to give them just a better shot at having a high quality of life. So obviously, this discussion is about neurodevelopmental delays or neurodevelopmental disorders. We're going to kind of stick specifically to children for the most part, but a lot of this can be true in many adults. So we'll just keep that in mind. So just an overview of what a neurodevelopmental disorder is. It's a group of childhood conditions that affect the brain and the neurological system, including, but not limited to, ADHD, ADD, autism spectrum disorder, dyslexia, different motor disorders, communication disorders, behavioral disorders, Tourette's syndrome. We can also put PANS and PANDAS into the mix. Different mental health conditions like anxiety or depression as well can be grouped into this disorder. So why? Why might somebody be at a higher risk of developing a neurodevelopmental disorder rather than somebody else? Well, first, things we can't really change so much, but are genetic factors, right? What were mom and dad like? Sometimes you might have mom who was really strong in one neural activity, but kind of poor in another. Maybe dad was also really strong in that same activity and really poor in that same activity. And then they really like each other because sometimes opposites don't attract. And then they have a baby, and that baby might have an amplification of the phenotype that those parents were expressing, right? Epigenetic considerations. So you've probably heard of genetics. You may or may not have heard of epigenetics, but epigenetics are kind of the things that turn genes on and off. These are the things that we can have more control over. So we're thinking not only what was the child exposed to either prenatally or perinatally, but what were the parents' lifestyles like before they ever conceived, right? Were mom and dad physically active, or were they couch potatoes? Were they eating a bunch of processed food, a bunch of junk, or were they eating more organic? Were they exposed to toxins in their environment, poor air quality, poor water quality? All these things can actually play a role on our offspring. So it's very important if you're considering having kids to really make sure you take care of yourself, because it's not just you that you're affecting the next generation and then the next generation. So that's really important. But then considering what has the child then directly been exposed to, like I said, either prenatally or perinatally, in the womb or outside of the womb. What kind of toxin exposure did they experience? What was their nutrition like when they're in the womb? All right. So what was mom eating a good diet while she was pregnant? Things like that. And then there are some other things that are just unfortunately the luck of the draw, things that we might see with developmental disorders or delays, but differences in brain wiring, were there any neurotransmitter dysfunctions, things of that nature, change in brain morphology, or essentially, is the brain shaped differently? Are there any anatomical changes in the brain that just for whatever reason, that's the way baby developed? So these are all factors that might lead to a child with developmental disorders. So here's a nice little graphic. So like we mentioned, so these four things kind of contribute, but you've got your common causes like genetic, inheritance, pollution and toxin exposure during or after or before pregnancy, alcohol and drug misuse during pregnancy. There's the machinery changes or that wiring changes. So whether there's a genetic mutation, epigenetic dysregulation, the pathways being disrupted for whatever reason, the synapses being disrupted for whatever reason. Our brain morphology changes, brain too big, brain too small, decrease in number of cells. The gyri, or the folding of the brain, have they been affected? And then here are just some common symptoms of neurodevelopmental delays, but trouble with social engagement, feeling overstimulated by sight, sound, things of that nature, effects in mood or behavioral changes. Seizure activity can actually be a part of this, and then trouble with sleep and gut and heart. All can be sorry, expressions of neurodevelopmental disorders. So kind of going off of that, or piggybacking off of that, some signs and symptoms, common signs and symptoms of neurodevelopmental delays might include, like I said, struggles with social interaction, communication challenges. We might see repetitive behaviors or maybe some obsessive behaviors like hand washing or turning the lights on and off, or, maybe bedtime routine. You might notice this the most. The child might be hyper responsive to sensory stimuli, like I said, with different sensory processing disorders. They might have missed some developmental milestones, whether that be a delay in their motor skills, right? Grasping, crawling, walking, speaking. These are all expressions of motor output. And then were there any cognitive impairments? Are they having a harder time learning? Do you feel like they're not keeping up with their class? Are they not able to grasp concepts as well as maybe some of their peers? And I know we don't like to always, compare our kids against other kids. That's not always the best thing to do, but just keeping these milestones in mind, like where should my child be? Are they hitting these kind of preset milestones or not? And then traditionally, how do we assess for neurodevelopmental disorders? First, we're going to look at just observing the child. What's their attention like? What's their behavior like? What's their concentration like? Are there any dimorphisms or any changes in their physical appearance? Are they engaged? Are they focused? Do they have any eye movement issues? Are there any other general things we need to consider? What's family like? What's family engagement like? Things of that nature. And then we can get into more specific testing, like scoring tests, such as the Conners, SCQ, MABC, so on and so forth. There's specific developmental tests that you might have experienced, like the 10-question test, the Denver 2, the ASQ3, the Bailey 3, the GMDS ER, so on and so forth. And then there are specific assessment tools for different conditions, like the ADOS2, so on and so forth. We can measure growth. We can measure physical and neurological function via an examination. And a lot of the professionals that are great at administering these tests and giving you that definitive diagnosis, or giving you that diagnosis, is going to be your neurologist, your neuropsychologist, or maybe your psychologist. And while here we're definitely concerned with the diagnosis, we don't necessarily like to put people in a box, right? Everybody's kind of on a spectrum. So yes, you may have been diagnosed with ADHD, but that diagnosis doesn't necessarily tell us what's wrong, right? It doesn't really get to the root cause of why ADHD is happening in your child, right? There are a lot of things that can cause ADHD, but at the end of the day, it's only given one diagnosis, and a lot of times one treatment, right? Let's give them Adderall, let's give them Ritalin, let's give them Vyvanse. And a lot of parents don't want to do that for a lot of the obvious negative side effects that follow that. And especially if we can keep medication to a minimum at such a young age, like I mentioned, that just totally changes the trajectory of their lives. So what is the alternative option that we offer here at Delta Neuro Health? And that is our specialty, our bread and butter, which is functional neurology, right? And that's what I'm going to spend most of tonight talking about. So what is functional neurology? It is the clinical evaluation and treatment of conditions affecting the nervous system, right? Okay. Some of the core principles of functional neurology are the concept of neuroplasticity and functional integration. So, like I said, we are concerned if your child has a specific diagnosis. That is helpful, but it's not the end all be all for us, right? At the end of the day, we are trying to assess the specific physiology of your child's brain, the specific function of your child's brain, not ADHD brains, but your child's brain, to see where their strengths are and where their weaknesses are, and how we can leverage those strengths to improve the weaknesses using the concepts that I mentioned, neuroplasticity, and then integrating it all together. So our approach, it all starts with a thorough neurological evaluation, and then a specific and individualized treatment plan is implemented. So before we can ever start a treatment plan, we have to know what's wrong. We have to know what's right. We have to know what's wrong. So the evaluation allows us to do a deep dive and figure out your child's strengths and their weaknesses and really understand what's causing their delay, right? And then once the areas of interest have been identified, then we're going to give them that specific treatment plan to fix or to rehab and strengthen those weak areas. We also implement a lot of at-home exercises. So it's not all just come in here and then you go home. We expect our patients to be hands-on, where, you know, we're working with patients. We want to see them actively get better. And then as we see things are improving, we then hand off a lot of those exercises to mom and dad so that they don't need to see us as much and they can continue to build that plasticity at home. And then I like this graphic here because it just does a good illustration of the brain and the functions of the brain. I think a lot of times we forget that the brain controls literally everything, and the brain is a sensory motor organ, right? So it's taking in all this information, like you see the music notes, the eyesight, the speech, the hearing, things like that. It takes in all this information, and then it has to process all this information. And then based on the information that it receives, it creates a motor output, right? And that motor output may be things like motor function, like you might think of with writing or walking or other types of physical activity. But motor function could also be thoughts, emotions, behaviors, things like that. Those are all outputs or motor outputs of the brain. And based on, you know, how they're sensing the environment, how they're integrating the sensation of the environment is going to dictate how the brain is going to deliver its output, right? And that's why we need to identify, is it, where in the brain are we failing, right? Okay. So here are just some general benefits of functional neurology. So we tend to see improved outcomes, enhanced motor skills, better cognitive performance, improved social interactions. We see, so motor skills, again, could include all those things we mentioned: behavior, speech, writing, reading, things of that nature. Improved social interactions, And then a personalized treatment plan, like we mentioned, it's tailored to each individual's needs and abilities. So we're going to adapt to every patient that we encounter, right? Every child, like I said, it's a spectrum. So some kids may be able to do X, Y, Z. Other kids may only be able to do X, and some may only be able to do X, but in a different way, if that makes sense. So we really have to be dynamic with our therapies, and we have to really, like I said, tailor them to each individual patient. And it's a holistic approach, right? It's not just a here, take this pill, call me in 2 months, let me know how things go, right? It's we're looking at everything. We're looking at how is your child's brain functioning. We're also thinking about how is that child's environment? How is that child's diet? What is the child's lifestyle like, right? How are these things affecting their brains? A lot of kids, we really need to look at gut function. And not to go off on too big of a tangent, but you've probably heard of the gut-brain axis. And this is especially important in children with developmental delays because so many neurotransmitters are produced in the gut. And if you look at the diet of today's children, it doesn't look so good. I know when I was a kid, I wasn't eating the healthiest foods. We've got Kraft mac and cheese and Gatorade and, not to call out things specifically, but, chips and candy and soda and, all this garbage. And just like that's what kids crave because it's just they found a way to hijack a lot of those dopamine reward systems in our brain with these products. And I use the word product because it's not really food, it's more of a product. And these things are deteriorating our guts. They're spiking our blood sugar, which is contributing to their child's behavior, their ability to focus. If they're not getting the fuel they need to have sustained focus and energy, then of course they're going to have these crazy blood sugar spikes and crashes where they're going to be, super hyper and then a zombie by the end of the day. So no wonder they can't focus because they may not have the energy they need. So tangent over, but that's something that we definitely take a look at here and take into consideration. So just as far as the testing goes here, we're looking at multiple different things within the world of neurology. So we're looking at autonomics, we're looking at cranial nerves, we're doing sensory testing, we're doing motor evaluations, we're checking primitive reflexes, a little bit more on that here in a second. Muscle strength, eye movement, vestibular function, we're checking balance, we're checking cognition. All of these things we try to capture and create objective data and a baseline for your child so that after we perform therapies for X amount of time, we want to reevaluate and see, are we actually making objective improvement based on the expression of your child's brain? And are we seeing tangible, substantial improvements in your child's symptomatology, right? And what you're seeing at home. So here's an example of just the eye movement testing. So we use something called VNG or video nystagmography or video oculography. And these are infrared goggles that are tracking eye movements. So I mentioned there are a lot of reasons we might have issues with focus, or someone might be given the diagnosis of ADHD, right? Here's one of them. This child had a really hard time focusing and concentrating in school, right? Is Adderall going to fix his eye movements? Probably not. These are his eyes. So he was supposed to be tracking this blue line, or there's a red dot going left and right as depicted by the blue line. And you can see the red and the green lines are what his eyes were actually doing. And they're really not flush with that blue line at all. Okay. But then after just a couple weeks of therapy, oh, here we go. After a couple weeks of therapy, we were able to get his eyes to look like this. They're tracking that line nearly perfectly. So you can bet, and he did, that he had a much better output of his focus. He's able to focus in school much, much better, because before he wasn't even able to keep his eyes still for more than 3 seconds. And now he's following the target for 30 seconds to a minute without any problems. So you can bet he definitely had improvements in his focus. So one thing we might take into consideration with children with ADHD or other developmental delays. Okay. Something else that we pay special attention to with kids with developmental delays are primitive reflexes. There you've got Maggie there from The Simpsons. She's not trying to hug you. She's just expressing her Moreau reflex. So what are primitive reflexes? They are, as it says, involuntary motor reflexes that are present in infants, but not healthy adults and children. Okay. So these primitive reflexes should be present in infants, right? But as we grow, as we develop, after a year or two, these should all really be gone. And there's a reason we have them when we're infants, because it gives us a higher chance of survival, right? It gives us a higher chance of bonding with mom. The rooting reflex, for example, is helpful for establishing a latch when breastfeeding. So that one is, you can take your finger and stroke the side of maybe your child's cheek or your cheek. It won't work on yourself really, but if you stroke someone else's cheek, what should happen is nothing. What shouldn't happen if the rooting reflex is present is you'll see a little lip twitch towards the stroke. Okay, we don't want to see that. We want to see that in infants. We don't really want to see that anyone above an infant. And then the Moreau reflex, just like Maggie here. So this is our startle response, right? So this is present in a lot of adults still. This is probably one that gets retained. I see retained quite a bit. But basically, you hear a loud sound, your hands go up like this. That's the Moreau reflex. We can test for that. So this is another thing that we might want to consider, still using the example of ADHD. But if you've got somebody who is always hyper aroused by lights, sounds, they have that Moreau reflex, they're always like kind of on edge because of it, they're going to have a really hard time focusing, right? Because if you always are getting startled, you're going to be on edge. You're not going to be able to focus on math or on history or whatever else you're trying to focus on. The Gallant or Perez reflex, that's where we might stroke the side of the spine. And if we see, the child twitch towards the side of the stroke on the spine, that would be intact Gallant or Perez reflex. A lot of times we see this reflex is retained in bedwetters. So that's definitely something we look at with that population. Then we look at asymmetric or symmetric tonic neck reflex, and that's where we might have the child on all fours, and then we turn their head quickly left and right, and we want to see if their elbow bends. That shouldn't happen. So that child might need some vestibular therapies as part of their treatment approach. Grasp reflex, this one breaks a lot of moms' hearts, but grasp reflex is where you stroke the palm, and what happens is the fingers will curl. So if you put your finger in a newborn's hand, they'll grasp around your finger. And unfortunately, it doesn't mean they're trying to hold hands with you, but this is a good reflex for baby to be able to hold on if they need to, or to create a bond with mom. So you can test for this in a child by just maybe using a paintbrush or possibly your fingernail and stroking along the palm and seeing if the fingers curl. You've got the stepping reflex, where you bring the child's foot, top of the foot or bottom of the foot on a table, and they should make a stepping motion. And then Babinski, this one is, I see this one anecdotally present with a lot of people with anxiety, some toe walkers as well. But what this one is the doctor will stroke on the underside of your foot. What should happen in a child or an adult is either A, nothing, or the toes should curl a little bit. What should not happen in a child or adult is the toes splaying or going upward. We don't want to see that. That would mean that the Babinski response is retained. Sometimes that response can be, we can see it again in brain injury patients, TBIs, so on and so forth, but also in children with retained primitive reflexes. So that's something we also want to address. And I've also got this image of a person with brain and spinal cord. So these reflexes, they go from the sensory organ or the sensory location, they go to the spinal cord, they invoke their response, or they're processed in the spinal cord, and then they produce their response. As our brains develop, as our frontal lobe develops, we actually start to inhibit this spinal cord response, right? So if a child has a delay in their neurodevelopment for whatever reason, then we might see these primitive reflexes retained, or sometimes they come back, like I mentioned. So there are a lot of ways we can address primitive reflexes. Each specific primitive reflex has its own remediation exercise, but we don't just rely on the remediation exercise. We also want to strengthen those areas of the brain that inhibit those reflexes. So such as the frontal lobe. And as we test these reflexes, if we see that they're diminishing and that they're getting weaker and weaker and no longer present in the child, that is now telling us that we are actually strengthening those parts of the brain, right? And if we can strengthen those aspects of the brain, we can improve other symptoms that those are associated with, right? So here's just a quick overview. So I mentioned this, if you're watching this at home, you can pause, but this is essentially what I just explained here. All right, so what do some of our therapies look like here at Delta Neuro Health? Obviously, it's going to be, like I said, individualized to each patient, but here's some of the fun things that we might utilize. We've got interactive metronome, which is good for timing, focus, concentration. We've got a Dynavision board here, which is good for hand-eye coordination, reaction time, things of that nature, go, no go, response inhibition, those sorts of things. And then just those last couple of things were just showing us that no matter where we are, we can use what we have to stimulate and exercise the brain. Because believe it or not, functional neurology didn't exist 3,000 years ago, but we still had brains, and our brains were still adaptive and responsive to the environment. So we don't need all this fancy technology to make a change in the child's brain. Everything in our world is going to make a change, for better or worse. We just have to be specific about what we're doing so that we can change it in a positive way. Okay. And as functional neurologists, we're not expecting that we're the only ones treating your child. There's a lot of great practitioners out there who are doing wonderful things. So most children with neurodevelopmental disorders are seeing a number of providers. Speech language pathology is a big one. Occupational therapy, you might be seeing a cognitive behavioral therapist, a physical therapist, maybe a classic pediatrician, other specialists like equestrian therapy or music therapy, things like that. However, we work synergistically with these providers, offering a unique approach. So we're not trying to take anyone's place. We don't claim to be the end all be all. There's a lot of great work that other practitioners are doing. But what we do really well is strengthening the neurophysiology of the brain. So I might say, and what we see is if we can actually make positive changes in the brain, the child now becomes more receptive to a lot of the other therapies you might have them in, right? I have patients who are in speech language pathology who have behavioral disorders and speech delays. So while it's great that they need to be doing speech therapy, if the speech therapist can't get over the behavioral disorder to actually implement the therapy, then they're just going to be at an impasse the whole time. So what we've done in some cases is we're able to get the behavioral, the uh, responsive symptoms reduced in children who have those issues, where they're able to be more receptive to therapies, right? They're not as stimulated by things. They're a little more receptive to the therapist. They're not putting up a fight every time they go see the therapist. And now they're able to do their speech therapy. And now their speech is going to get better, right? So we're also working on the areas of the brain that control speech, but then also having the provider reinforce all of those nuances of speech as we work on the parts of the brain that control speech. It creates this beautiful tapestry of providers where we're all kind of helping each other. And at the end of the day, the child is the one who benefits the most. Uh, so in summary, there are a number of types and causes of neurological developmental delays in children. By assessing and addressing these delays via a neuroplastic and therapeutic approach, we can make huge positive changes for these children. Every child's brain and their goals are different, and we must treat them as such. That is so important to understanding this lecture. Early intervention is key. The sooner we start, the less negative plasticity we have to work against, and the more or the better we can alter that trajectory, right? And if you think this information is relevant to a child in your life, please feel free to give us a call. We can schedule a free consultation to discuss your individual needs. If you'd like to learn more about functional neurology, what our clinic has to offer, other things we address within the world of functional neurology and in this clinic, please feel free to follow us on Instagram and Facebook. That's where we probably post the most. LinkedIn and TikTok. We also have a podcast, the Neuro Health broadcast, which is broadcast on Spotify, YouTube, and Apple. We have a lot of great episodes on childhood neurodevelopmental disorders specifically. So we're going to take this time to answer some questions here in a second. But I just wanted to thank you all again for coming. I really appreciate it. It means a lot to me. And hopefully you were able to gather a lot of great information from this. Here's our number if you want to jot that down, and then also our website, or sorry, my email address. But yeah, thank you very much. So I'm going to go ahead and pause the recording before we start the questions.